Welcome to SBW Talks. Today, on this episode, we have Dr. Ronda Farah, a board certified dermatologist and associate professor at the University of Minnesota, founder of Illuma Dermatology in Medina, opening in spring 2025. Congratulations, Dr. Farah.
Thank you so much for having me. Thank you. I'm very excited to open that new clinic.
Oh, we're so excited to have you. I think in this episode, we will be talking about aging of the skin. I know a lot of my friends are aging and they're always worried about their skin. And as you said, maybe go see a dermatologist. So let's talk about Botox, fillers, and lasers. What can you
Oh,
say?
those are my favorite topics. Thank you for inviting me to do that. So let's just start from the beginning. So I'm a dermatologist, so I'm a physician, and then we spend time doing a residency in dermatology. And as an associate professor at the university, part of what I do is train the residents in our community to go out and do cosmetics. So that's things like Botox, Dysport, ZMN, lasers, using topicals to help skin aging, scars, acne scars, things that affect our patient's appearance. Because in dermatology, we truly feel that taking care of the way the patient feels about themselves, their skin health essentially, can impact how they, feel overall. So we're just here to serve our community and do it in a really safe way. And so let's start out with Botox. And I'm going to talk a little bit about toxins. There's lots of different types of toxins, and Botox is one of those name brands. But I always like to say at the beginning, this is not personal medical like advice, okay? This is medical information. So everyone should see their own dermatologist, their own physician to get treated because we're just kind of talking general.
Correct.
All right, so I would say so Botox, and there's other companies too. So Dysport, Xeomin, Daxxify, those are toxins that we use to help treat wrinkles. Okay, so when we're moving our face, lifting up our eyebrows, smiling, and we see those lines, like right now on the camera, I can see my little we call them crow's feet out at the side by the eyes. We can use these toxins to paralyze those muscles, or even soften, maybe not completely paralyze, but make it so we're not moving that skin in the same way over and over again, which then eventually results in a wrinkle. Okay. So right now, what you're seeing is, especially like a trend for younger patients coming
Hmm.
in, they're starting to see those lines form, and they want to treat early so that the lines don't almost like fissure in and become irreversible. And if that's something a patient's interested in, they can, see a dermatologist or plastic surgeon to that.
What age do you think we should start kind of going into this, getting into this?
That is such a good question. So there is not a blanket age, okay? Everyone is so different. I've had people that are very young in their 20s. Their career might be focused on acting or modeling,
Mm.
or they have a particular line, even for a medical reason that they want treated. And then I've had patients show up in their 60s, 70s, even 80s who want to get treated with toxin. But the thing about toxin is you need to think about what is the concern you have on your face? Because a lot of people come in and just say, I want Botox, but really, Botox might not be the best thing for them, or just toxins in general, is they might actually need fillers or lasers to achieve
That's
the effect that
interesting.
they're looking for.
Wow, that's interesting. And what do you feel about these young kids going into Sephora and buying, cleansers and all these things?
Well, as a dermatologist, of course, we love these, young kids having a lot of interest in their skin. We like to get the word out about using sunscreen. We like it when our patients apply sunscreen regularly to lower the risk of skin cancer. It can also help prevent premature aging. But I also don't think any of us need to spend a ton of, like a lot of our financial resources in young children, like using skincare products. Like my own kids are, under 10 years old, and I just have them on bland moisturizers and sunscreens right now.
Yeah, that's true. And what is the difference between Botox and a filler?
Okay, that's a really good question. So toxin, like for example, my toxin's kind of worn off if you can see my face, but typically it will like make it so the muscle, it's not moving. So when you lift up your forehead, it's hard to lift up your forehead when you have Botox in. So these lines up in your forehead or your crow's feet, those ones can't form when you're making that movement. And then some people believe that eventually you like kind of learn not to make that movement if you repeat it. My typical patient might be every 4 to 6 months or something like that. And sometimes we can use them to also relax muscles around the lips, relax muscles at the chin, and everyone is so different. I can do the neck. I can lift up. It's all the dermatologist or the plastic surgeon understanding where the muscles are, and we're all very good and skilled at that. And helping those muscles relax to give a youthful effect. Whereas fillers, those are a little bit different. They're for volumizing the face. So as we age, we can lose a little bit of our fat and bone structure, and the tissue essentially thins.
Is that the collagen? A lot of people get collagen.
Collagen and hyaluronic acid, but so fillers, most of them are hyaluronic acid. There are some other fillers, polylactic acid, etc., but they are revolumizing. I like to think of it like a pillow that just gets a little bit deflated, and I
Okay.
say that with being very humble because there's just like a little bit of filler in my own face. But
You look great.
thank you, that's very kind. I do have a little bit of filler in my face, but it kind of revolumizes the face. So our toxins are just kind of relaxing muscles, and our fillers are revolumizing the face. And it's really the skill of the person doing it. It's not one or the other. It's typically a combination to get the effect over time of what the patient's looking for.
That is so interesting. I mean, we always hear about Botox and we feel like that's what we need, but as you said, you must go into a dermatology office, see a dermatologist to really see what you need. Like it may be a Botox filler or a laser. And what's a laser?
Yeah, so okay, so then lasers also are another whole world of the cosmetic industry. And our dermatology residents, I train them to, really understand the light, the type of technology that's being delivered. Is it something that's going to really tighten the skin? Is it something that's going to change the scar? Is it something that's going to help with tone and texture? And so, thinking of the laser world sort of similar to Botox and filler sort of world, in that I always tell patients like your dermatologist, the one that you selected, or plastics or whoever you're seeing, they understand their technology and
Interesting.
how to use it and what it can achieve for them. Like I have this one laser I've been using for like 14 years all the time. I can get that laser to do so many amazing things in the experience of my hands. And there are certain wavelengths of different devices, some that can tighten wrinkles, some that can help with scarring, some that can help with the neck, some that can help with discoloration. Okay, so it's not necessarily like name brand, because I might have sometimes people coming in saying, I need, this one specific, they'll name a laser brand, like I need this laser brand. But it's not, there's so many brands
Hmm.
with that technology, right? It's really understanding the technology and then the experience of that physician treating you to get the maximum effect.
What's so interesting is how you work so closely with plastic surgeons because we thought plastic surgeons did something and dermatologists did something, but is there like a correlation between?
I love my plastic surgeons, and I'm gonna shout out to plastic surgeons because we work as a team. They're very surgical, and sometimes patients can achieve what they want. They can't with toxins, fillers, lasers, and other things. So we have to reach out to our colleagues, and some patients might choose to have a facelift. They might choose to have a neck lift. They might have liposuction in the neck, and those are a lot of things that plastic surgeons will do. Some dermatologists do them. I'm primarily at an academic institution right now, so it's plastics mostly doing that, and I love working with them. And in medicine, it's typically board certified dermatologists and plastic surgeons and oculoplastics. There's typically their curriculum, kind of like when you go to school, is very focused on making sure they have the skills to safely treat patients. So that's why I reference them a lot because I'm like, if you're not going to see a dermatologist, maybe see a plastic surgeon. Is another option, another field that has really good training when they come out of school.
Wow, that's awesome. And how about nutrition? Do you think that affects with skin aging and skin taking care of your skin?
Yeah, I mean, so that wasn't something I was so into many years ago, but I think a lot of us have started to wonder, like, what's in our food, what all of these things. But I think generally for skin health, I think a healthy diet, fruits and vegetables, and getting protein is really important. Right now, there isn't really a formal recommendation to change someone's diet for skin health and skin age, but I will say, like, it never hurts to keep a healthy diet. I don't right now take any supplements because supplements are not tightly regulated by the FDA.
Wow.
And so, like, if I'm going to dedicate myself to a supplement, I really have to trust that manufacturer.
Hmm.
And so I don't really like take any supplements. And if my patients are concerned about their vitamin D or their iron or anything, I will just check it for them to see if I need to replace it.
Okay. And what about water intake? 'Cause sometimes we're forgetting to drink our water.
Yes, water is important. I would say it's important to stay hydrated, but no one would be able to, or the idea of hydrating so much that you can like change the appearance of your skin
Hmm.
I worry a little bit about like taking in too much water that's not necessary.
Oh,
I
wow.
always say there's a whole field of those kidney doctors, and they would say, "Don't you trust your kidneys?" So, stay hydrated as you would for a healthy
Amount.
amount. Yeah,
Okay.
but I don't have a formal recommendation to anybody to like intake extra water for their skin health or
Okay.
anything.
And what about dark circles? I know when I'm tired, I get dark circles under my eyes. Like, what are some?
Yes. Well, that is such a good question. So dark circles can be what we call multifactorial in medicine.
Mm,
So for some people, it's that loss of volume around the eyes, maybe loss of fat. It can be also excessive skin. For other people, they can get too much fat under the eyes in the spot that makes it look a little darker. Some people have had filler placed there. It could have been an incorrect filler. Other people, it's actually a change in their skin tone. Like the skin is actually discolored in that area. And some people, they might have, a health issue, like their thyroid is off.
mm.
So that's really hard to sort of blanket statement. Some people even have allergies, and that can cause dark circles or eczema. So there's so many things that can cause dark circles. So if a patient asks me where dark circles, the most important thing is that I take a really thorough history and I take a look at their face and the whole picture to try to figure out what's going on. And if I can't figure out what's going on, or I think it's surgical, I'll often send them either to plastics, or there's this whole field called
Oh,
oculoplastics.
wow.
And those are ophthalmologists with additional training in eye plastic surgery. So those colleagues will typically be pretty helpful for that.
How about putting those cucumbers on your eyes to cool them? Do they ever work really?
I think probably just, the concept of cooling the face in general helps with less swelling,
Okay.
but like I don't do it myself. But, I think that that's probably where that comes from.
And
Because
you see all these, like I see on social media, people putting their face in ice water. What is that all about?
I haven't seen that one, but I would imagine that it's just a reduction in,
Inflammation?
swelling
Yeah.
in the face. But I don't like the cold, so I don't think I could do
And
that.
we're like at negative 29 degrees here today in Minneapolis, Minnesota.
My husband just likes ice fishing and all these ice sports, so I'm destined to be in Minnesota.
Well, no, Dr. Farah, I think this was a great podcast. Thank you for being here. One topic I think in our next episode will be hair loss. I know a lot of women are facing that, going through that. She knows a lot, and I think that could be a next episode we have with Dr. Ronda Farah.
Yeah, I love talking about hair health, scalp health, the hair industry, and the type of products available over the counter for that: conditioner, shampoo, dyeing hair in the process. So I just want to end by saying thank you so much for having me. You're so amazing with your whole new podcast and your other business that you have also. And then I also want to say that if you guys were listening today, just a reminder, this is medical information, not personal medical advice. You can find a board certified dermatologist by going to www.findaderm.com. You can enter your zip code and it will identify a board certified dermatologist in your area. And dermatologists are experts with their skin. Your dermatologist knows how to take care of your skin. So I really think if you're interested in what I'm talking about, toxin source lasers, see a board certified dermatologist. And you can find me at Dr. Ronda, Ronda Farah, on the internet, Instagram, TikTok, Facebook. Thank you.
And if you're in Minneapolis, go visit her Aluma Dermat.
Alluma Dermatology in the spring. It's not open yet, but thank you so much. I'm so humbly thankful that you mentioned that.
Yes, thank you. We're so happy to have you here. So stay tuned for our next episode. Thank you for watching.